to my super simple ventilation series. I'm going to be covering 5 main topics of ventilation. Let's jump right in. The first important thing to understand about ventilation is the difference between positive pressure and negative pressure ventilation. When we breathe normally, we use negative pressure. When I take an in-breath, my rib cage moves outward, my diaphragm drops down, and I'm creating a vacuum inside my lungs. And that sucks in everything that is coming from a higher pressure. So the atmosphere around me, kind of like a black hole. On the other hand, when we ventilate using a ventilator machine, we use positive pressure. Now, of course, that doesn't apply to the iron lung, which was the first ventilator ever created. It consisted of a cylinder which the patient would lie inside and a set of bellows which would pump out the air and create a negative pressure around the patient's chest, which would allow the patient's chest to expand and, of course, draw air inside the lungs. Nowadays, our ventilators are fairly small, fairly portable, and they plug into a mask which goes over our face or a tube which goes down our throat. Now, the fact that our modern day ventilators function completely differently to the way the lungs do is a very important concept to understand. The lungs are used to starting off at 0, going down into the negative pressures and coming back up to 0. Ventilators start the lungs off at 0, pump them up the way you would pump up a bicycle tire, and then come back down to 0. The lungs are not designed, not adapted to functioning in that way. And so ventilation with a machine inevitably causes some kind of damage. The key to ventilating a patient safely is to understand the ranges you're allowed to work in and to aim to minimize the damage you're causing. Right, so now that you've got that under your belt, we can talk about the first point of ventilation, FiO2. Now, that might sound complicated because it's got letters and numbers in it, and immediately you're thinking about maths, but actually it's really simple. It stands for the fraction of inspired oxygen. If you're still unsure, let me translate. It is the percentage of oxygen that I'm breathing in. So in the air around me, the percentage of oxygen that I'm breathing in is 21%. If I'm ventilating somebody and giving them air, that can be anywhere from 21%, you don't want to go lower, all the way up to 100%, FiO2. The second key concept of ventilation is PEEP, positive end expiratory pressure. Now, if that sounds like a long and intimidating name to you, don't be surprised, most people find it a little bit confusing, but by the end of this video, you are going to nail PEEP. Now, the lung is basically a balloon, or to be more accurate, it actually consists of millions and millions of tiny little microscopic balloons. We call them alveoli. Now, when we breathe in, the alveolus expands, and of course, it's surrounded by tiny blood vessels. And the oxygen and air goes inside the alveolus, filters past the wall of the alveolus and into the blood vessels, where it is then taken for use by the body. And of course, when we breathe out, the alveolus collapses. But what happens in a condition like COVID or bacterial pneumonia? Well, the alveolus fills up, just like our noses fill up when we get an infection. It fills up with mucus and fluid and with disgusting gunk. And the normal process of inhalation and exhalation becomes impaired. I've brought along a diseased lung full of mucus, which in this case is a lot tastier than actual mucus. And I want to simulate what happens when this poor little alveolus is full, and trust me, there's a lot of syrup in here, is full of mucus, right? So I'm gonna blow it up. Wish me luck. I had to put a lot of work into that. Okay, and that was only one breath. So we're gonna breathe out now. And of course the alveolus collapses down. And I gotta do that again. So now we've got a patient who is battling to breathe. Their lungs are getting full of sticky gunk and they're tired. And we're going to ventilate them. We're gonna give them a chance to rest their rib muscles and their diaphragm muscles and hopefully heal while they're on the ventilator. But But we're having the same problem when we ventilate this patient, because now our machine is trying to open up this lung. It's having to work really hard. We're having to put a lot of pressure into this situation with every single breath. So what do we do practically? Because the problem is not really blowing it up once it's got going. The problem is getting it going from there. So surely the answer is, don't let it get down all the way to 0. We want it to stay slightly open. Watch this. Inspiration, expiration. We'll keep it there. Let's try blowing it up again. Oh, that was so easy. It was like blowing up the healthy lung. So I went down to there and we decided we're going to keep a positive pressure, right? Because there is pressure inside this balloon. We're going to keep a positive pressure at the end of our out breath of exhalation. And that is PEEP. Positive end expiratory pressure. It's genius, right? And I've had lots of people saying, well, can't you just suck the mucus out of the lungs? Well, they're asking us to suck mucus out of millions of invisible microscopic little balloons. We do not have the technology for that yet, but we do have the technology for this. And PEEP is the answer always to a wet lung, because you don't get that. So we've got our sick patient on FiO2 of 100%, and we've pushed his PEEP up. He's on a mask now, but we can see that he's battling. We don't need a degree in medicine to tell that this guy is in trouble. He's breathing fast. He's bracing himself. He's using muscles that you wouldn't normally use to breathe. He can't even talk in full sentences because all his effort is going to breathing. No one can sustain that kind of breathing forever. We want to help him. What do? We've already got a mask on his face. We've got him attached to the machine because we're giving him PEEP, and we're running his PEEP at a baseline so that every time he breathes in, it's on top of the PEEP and then it's back down to the PEEP. But let's add something to that. And that's, of course, the third key element of ventilation. We call it pressure support. And all it involves is the patient triggers a breath. And I say, hey, here's a little bit of extra. Here's a gift for you. There's some pressure for you. So the patient triggers, the machine goes, oh, let me help. There's your big breath. It's a patient-initiated breath. The patient is in control of his own breath. The machine's not going to give him extra help if he doesn't ask for it. And it is just a supported breath. That's why we call it pressure support. But let's say that's not enough. The patient's oxygen levels have dropped to the point where the patient is almost not triggering any breaths at all. And of course, the machine can't help if there's no breaths triggered. So let's say the patient has got so bad, he's only breathing like 6 breaths a minute for whatever reason. What do we want to do for him? We want to give him some breaths that the machine triggers. And of course, when I say the machine, I'm talking about you as the person who's setting the machine. And we call those breaths controlled breaths, or we also call them mandatory breaths, meaning we have insisted that this breath is going to happen. Whether you like it or not, patient, it's coming your way. Here's a breath, boop, that you neither asked for and did not initiate, but you need it. That brings us to our next final concept. We need to decide how many of those. So we're going to set a rate, a respiratory rate of mandatory breaths. So let's recap. We've got FiO2, we've got PEEP, we've got pressure support, we've got mandatory breaths, and we've got a rate that we're setting for our mandatory breaths. The reason I've taught you these in this order is because that is the way you're going to approach your patient when you think about giving them assistance with their breathing. Once you've got those in your mind, you can start to ventilate. And of course, in the next video, we're going to discuss the numbers that you need to know for each of these steps. For now, I hope you enjoyed this video. I hope you learned something. I hope you understand what PEEP is, and we'll see you in the next one.